Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. The information provided in this program is to assist you in exploring all available options to help empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. So in this recording, we will be looking at the impact of birth practices, and I have highlighted it for you on the list of topics we are covering in this breastfeeding class series. So in this recording, we will focus on skin-to-skin contact. Now, skin-to-skin contact is the interaction between a mother and her baby, which is initiated immediately after birth. So why talk about skin-to-skin contact? Well, the World Health Organization stressed the importance of skin-to-skin contact within the first hour after birth for successful breastfeeding. And the initiation of breastfeeding is typically a direct consequence of immediate and uninterrupted skin-to-skin contact after birth. So it's natural behavior for most babies in skin-to-skin contact to slowly wiggle and crawl towards the breast. And skin-to-skin contact has been a low-cost and simple method that has helped thousands of low birth weight babies to survive, particularly in underdeveloped and developing countries. So while in the womb, a preborn baby fits perfectly into their free-floating environment where the temperature is constant and nutritional needs are met automatically and predictably, and the baby hears the mother's voice and heartbeat and breathing, and the baby is rocked to sleep, and the baby is never hungry, and the baby is kept warm and safe. Life in the womb is mostly good and organized, and then birth suddenly disrupts this organization. So after birth, the newborn baby is biologically expecting to hear the mother's familiar voice and heartbeat and smell her scent and taste her milk and have warmth from her body. And skin to skin contact after birth is as close as the baby can get to the womb experience. The breast has been referred to as a womb with a view. Now, ideally, all mothers and babies should have immediate skin to skin contact after birth, which is safe and uninterrupted and continuous, allowing progression through the newborn's instinctive behaviors. So, what are these instinctive behaviors? So, something amazing happens when a baby is in skin to skin contact with a mother after birth. And there are 9 observable newborn stages happening in a specific order that are innate and instinctive for the baby. So, mothers and babies who are allowed to go through the 9 stages have fewer problems with breastfeeding. The 9 stages are starts with the birth cry, then there's some relaxation, then awakening, activity, crawling, resting, familiarization, and then suckling and sleeping. And this may be over in a few minutes or it could last an hour or more. So a longer period of skin to skin contact is recommended if a baby hasn't suckled by 1 hour after birth. Now, understanding the stages is important to avoid forcing the baby to the breast with the misunderstanding that the baby is unable to latch. Okay, so let's look at the how. Now, babies should not be wrapped tightly after birth. They should be quickly dried off as they are placed on the mother's skin and then covered with a blanket to stay warm. Now, babies are wet from amniotic fluids, which will evaporate, and the evaporation takes heat away from the skin, which cools the baby down, which we don't want. So, if the room temperature is cold, one could cover the baby's head with a hat or a blanket to reduce heat loss. Just note, though, once parents are home with the baby, babies should not have extra layers of clothing or hats for naps or at bedtime. Because covering the head reduces the baby's ability to use the head as a little radiator, giving off heat, and we don't want babies to get too hot either. Anyway, um, while still in the birthing unit or immediately after birth, the mother should ideally hold her baby's skin to skin as much as possible and for at least an hour after birth without interruption. And she doesn't need to lie flat at this time. She might be more comfortable leaning back slightly at an angle, holding the baby between her breasts, and just letting the baby respond naturally. The mother in the slide seems to be sitting in a chair, though I'm guessing that's not a fresh newborn baby. So here are a few points on the benefits, or rather the importance of skin-to-skin contact. Now, separation from a mother is highly stressful for a baby. It is enough to make the baby physiologically unstable. So when a baby feels unsafe, the brain releases stress hormones, which increases the baby's heart rate and breathing in a basic fight or flight reaction. Somatostatin is a stress hormone that is released and it acts in the gut to decrease absorption of food, and it can actually um, potentially inhibit growth. So these stress hormones will continue to affect the baby while the baby is separated from the mother. And the separated baby will protest and cry to call for their mother. And this intense protest activity uses up vital calories that should actually be used for growth. And if the baby protests, if these babies, the protest signals are not listened to, the baby may go into an energy conserving defense mode. And if too much time is spent in this state of distress away from the mother, that can have lasting emotional effects. This state of freeze may look like the baby is asleep, but recent neuroscience research has shown that the baby may be firing pathways in the brain that in later life tends to increase anxiety. And this whole process reinforces emotional pathways in the baby's brain, laying down wiring adapted to cope with "it's a dangerous world and nobody loves me." And when returned to the mother, the stress hormones could take up to 30 minutes or even an hour to wash out of the system. So, in skin to skin contact, those stress hormones are reduced, and that allows for better absorption and digestion of nutrients. And it also reduces gastrointestinal problems. So, here's a hint: if you think your baby is colicky, stay in skin to skin contact with your baby. So, how long do we need to stay in skin to skin contact? Jill and Niels Bergman, in their book Hold Your Prem, say practice skin to skin contact for up to 90 minutes after birth, and this is critical for breast brain development physically and mentally. They say practice skin to skin contact for up to 6 hours after birth because this will help stabilize the baby's heart and breathing systems. Then practice skin to skin contact for up to 24 hours after birth, and this helps get the baby into a nice, stable sleep, cycling, and feeding pattern. And then continue staying skin to skin for up to 8 weeks because this is essential for attachment and bonding. And these are not just applicable on prem babies, this is also for full term babies. Okay, so what are some of the importance of skin to skin contact? When a baby is on their mother's chest in skin to skin contact, the breast odor will encourage the baby to move towards the breast and try to self attach. And babies in skin to skin contact learn to suckle more effectively because they are at the breast around. One study found that 96% of newborns who had uninterrupted skin to skin contact for an hour did not experience any breastfeeding problems during that first breastfeeding. Now, skin to skin contact also calms both mother and baby. Babies in skin to skin contact cry less, which means less stress and less energy use. Older babies who experience regular skin to skin contact often cry less and they appear less agitated. So, skin to skin contact soothes a baby and it reduces their pain as well. Skin to skin contact between a mother and a baby improves the maintenance of the baby's temperature. So, newborns are more prone to develop hypothermia, that's a potentially dangerous drop in body temperature, because of the large surface area per unit of body weight. And babies that are hypothermic don't feed well either. But within a few minutes of being held skin to skin, the mother's breasts adjust to warm a baby up or to cool a baby down in response of what the baby needs. Also, being on the mother's skin increases the baby's skin hydration, which provides a protective barrier from harmful bacteria entering the baby's skin. And skin to skin contact also colonizes the baby with good bacteria, which helps protect the baby from infections. Now, skin to skin contact also increases the baby's blood glucose, which means less chance of blood sugar issues and possible unnecessary top ups after birth. So, holding The baby on one's skin also increases the development of essential neural pathways, which accelerates brain maturation. And the development of brain function in babies also depends on the quality of the sleep cycling. And during skin to skin care, most babies fall asleep very easily and they achieve a natural deep sleep much easier. Sleep in skin to skin contact is also well organized, meaning that deep sleep or quiet sleep is longer and less disturbed than sleeping out of skin to skin contact. For the mother, skin to skin contact helps stimulates her milk production and supply, um, and the increased levels of maternal oxytocin are released while the mother is holding her baby in skin to skin. And this extra oxytocin or increased levels of oxytocin reduces the mother's blood pressure, it lowers her stress hormones, it reduces postpartum bleeding, it increases her pain tolerance. So many benefits. But full naked chest to chest contact between the mother or a partner or a grandparent, even siblings, but naked chest to chest contact between the mother and the baby is crucial when practicing skin to skin care, because the outer layer of our skin over the front of our chest is especially sensitive and powerful. It is packed with nerve fibers, and when the nerve fibers are stimulated, it or these nerves are stimulated, it sends a message of pleasure directly to the brain, and then in response, the brain produces oxytocin, which initiates a hormonal cascade, resulting in all the physiological benefits of skin to skin care. The increase of maternal oxytocin also creates a relaxation and well being response in the mother, aiding in her being able to respond with nurturing and affectionate behaviors towards her baby. And mothers practicing skin to skin care with their babies are more sensitive and aware of their baby's needs, and they feel more confident in their parenting abilities or the parenting skills. And then also, early skin to skin contact helps the baby to develop healthy attachments through the parent's sensitive and responsive and consistent care, which supports better social skills and higher self esteem in the child, as well as a better ability to manage their emotions. So many benefits. And skin to skin care is actually a place where development can continue outside the womb. Just a quick note, skin to skin care must always be practiced in a way that maintains the safety for both the mother and the baby. So, if the mother received medication that might impair her ability to practice skin to skin while she's in the birthing unit, she must be monitored very closely by the healthcare workers. Now, if a mother or babies are unable to initiate breastfeeding within the first hour, and especially if the birth itself was difficult in any way, continued skin to skin contact for, or continuing skin to skin contact for at least an hour until the baby shows interest in self feeding is very important. And then also stay skin to skin with that baby at least until the baby self wakes and feeds well. Now, someone said that the three most important and effective strategies to help a baby recover from birth related insults are number one, skin to skin contact. Secondly, skin to skin contact. And thirdly, more skin to skin contact. Let's have a quick look at that first feed, which is a direct consequence of being held skin to skin. Now, breastfeeding in newborns is an instinctive response found to be true only when the baby is left undisturbed after birth on the mother's chest to find their way to the breast. And many babies self attach to the breast and suckle well without help. Just need to give the baby time and a calm atmosphere. So have the baby lie on their tummy on your naked chest between your breasts. If the mother has large or soft breasts, maybe position a towel or a pillow under it or on the side of the mother's breast. It might prevent the breast from falling to the side. Try and position your arms in a way that can assist in protecting the baby from falling as the baby might leap or crawl, and have your breast accessible for the baby. Make sure the baby's hands are free and create support under the baby's feet if the feet and legs are moving in the air. And avoid interrupting the baby. Recognize the 9 stages of newborn behavior, especially noting the resting and familiarization stages. And again, understanding the stages is important to avoid forcing or rushing the baby to the breast or pushing the breast into the baby's mouth with the misunderstanding that the baby is unable to latch. The baby might lick and touch the areola and nipple and doesn't latch on immediately. It may take up to 20 minutes or more. And again, most babies take between 10 and 60 minutes before starting to breastfeed. Now, note that first time the baby suckles at the breast should be considered an introduction to the breast rather than a feed. So, no pressure on how long this feed lasts, or how well the baby is attached, or how much colostrum the baby takes. Obviously, if the latch is painful, we might need to adjust um, the positioning. So, after the introduction to the breast, most mothers and babies will fall asleep for a few hours. And then, when the baby wakes again, that's a good time to focus on your positioning and the baby's position and the baby's latch and breastfeeding, etc. If the baby did not suckle well before falling into a deep sleep, or if they didn't suckle for by at least 90 minutes after birth, maybe start hand expressing colostrum. If a mother stimulates a breast by hand within the first hours, the colostrum and the breast milk will come faster and in greater quantities. And we'll talk more about this in a future recording. So thank you so much for watching this recording. In the next recording, we will continue looking at the impact of birth practices, things that can help and hinder breastfeeding. Please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. And feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.